welcome to your drug-free workplace training program, Employee Education. Our course objectives today include identifying your policy components, listing drugs for which you could be tested and their cutoff levels, when drug testing can occur in the workplace, alcohol and drug awareness, and where to get help, or what we call employee assistance. We do a drug testing program here, and it is sponsored by the Ohio Bureau of Workers' Compensation, who is providing a grant for the training that we're conducting today. We're going to begin by talking about how there is an impact on the job. We know that marijuana use is on the rise. About 18% of Americans have said that they've used marijuana in the past year, followed by psychotherapeutics, cocaine, hallucinogen, inhalants, and heroin. We know about 75% of adults who report currently using illicit drugs are employed. 1 out of every 10 adults in the U.S. is addicted to alcohol, and it's been estimated that employees who abuse alcohol or drugs have twice as many accidents, 3 times as many vehicle accidents, and use 3 times as much sick time. 2/3 of all homicides are committed by people who drink before the crime. 2 to 3% of the driving population is legally drunk at any given time. And 2/3 of all Americans will be involved in some alcohol-related vehicle accident during their lifetime. We know that drug use becomes misuse when an employee is having high functioning and they start to use drugs, and over time their function starts to decrease. The first place that we would notice some impact is at work, followed by family, and then financially. So when we talk about a drug-free workplace program, we're talking about a program that keeps employees safe and healthy in the workplace. We know that there are costs and consequences for employers who do not address workplace substance abuse. Those workplaces will have more accidents, more frequent turnover, lower productivity, higher healthcare costs for their employees, increased theft, increased workers' compensation claims, poor product quality or service, high absenteeism, and even property damage. So what is it that you need to know? The basics are the policy, training requirements, testing, and employee assistance, and we'll unpack each of these now. Your company policy gives the reasons, expectations, the prohibitions, talks about possession and consequences. The reason that you have a drug-free workplace program is for health and safety of all employees. The expectations are not to be under the influence of drugs or alcohol at work. Any kind of mood-altering substance is not appropriate, even if it's an over-the-counter medication. I give an example of one time we had an employee come to work who had taken NyQuil. That makes you very sleepy at work. It's not appropriate. It's over-the-counter medication, but it altered his mood, and he was not allowed to take that at work. So if you're taking any kind of medication that might make you tired or sleepy, you should really be reporting it. Or if you have something that might make you dizzy, I'm thinking of an employee who was placed on a new blood pressure medication and was very dizzy. So he worked in maintenance, and we were able to accommodate him by keeping him off ladders and stairwells. So make sure that you're not under the influence of mood-altering substances. Do not use these substances. Do not bring them to work. Even if it's legal medication, if it's mood-altering medication or let's say alcohol, you're not allowed to bring those into the workplace. We know that cannabis products are legal in Ohio for recreational use. They are not appropriate in the workplace. You cannot have them on any of the company property or vehicles, even in your own vehicle if it's on company property. You cannot bring or be under the possession of any illegal substances at work. Or the consequence is you may lose your job. So when do employers test for drugs of abuse? There's several times an employer can. Pre-employment or pre-hire, random testing, post-accident, reasonable suspicion, and return to duty or follow-up testing. Some companies will test before you even start a job. You have to pass a drug test before you're really hired. Some companies will do random testing where all employees or employees that are classified in safety-sensitive positions will have an unannounced test at a predetermined frequency that's selected with equal probability, just like a random wheel. Some companies will test post-accident. All employees who are involved or contributed to an on-the-job accident would be tested. It's conducted after medical treatment is administered or within 8 hours of the accident for alcohol and 32 hours after the accident for other drugs. And then there's reasonable suspicion, a drug and alcohol test that is performed on an employee after the employer's either observed the employee using a substance or has objective information of such use, such as smelling like cannabis or having some, possession of any kind of substance that is prohibited in the workplace. That would be enough to target a reasonable suspicion drug and alcohol test. If an employee is given a second chance or they come forward to self-refer for an assessment and treatment if they think they have a problem, they will be asked to have a return to work test to come back into the workplace to make sure that they don't have drugs in their system. Now we're going to talk about how we test for drugs of abuse. The first thing to know is that we use a very specific chain of custody procedure. You need to have your photo ID. We ask you to empty your pockets so you're not bringing anything into the private restroom where the urine collection is done. You sign that you agree that this is your urine that is being sent to the laboratory for testing through the chain of custody procedure. When the urine is sent to the laboratory, it will undergo a certain kind of method. The first method is it's screened for any signs of adulteration or substance that is not supposed to be in urine. If there is something that's identified, it will be sent for secondary confirmation, which is called GCMS confirmation. It will determine how much of a substance is in the urine. An employee will have a split specimen taken, meaning that the urine is split into two different vials, so that if for some reason an employee wants to contest the results, they have the right to retest the exact same urine sample. What does a 5-panel test consist of? Cocaine and its derivatives, including crack cocaine, cannabinoids, THC, marijuana, cannabis products, opioids or heroin, codeine, and those types of substances, amphetamine and methamphetamine, and then PCP. There's also a 9-panel test that includes additional drugs. Check your policy to identify when drug testing can occur and what drugs they test for. The cutoff levels are predetermined levels of drug and metabolite that constitute whether a urine sample is actually positive or negative. Levels are established to protect workers from false positive readings. So when you receive a positive drug test, it means that that substance has been ingested. Cutoff levels are measured in nanograms per milliliter of urine. This chart establishes the 5-panel drug test, what the screening cutoff level is, and what is the GCS confirmation. I get most questions about cannabis. The cutoff level is 50 nanograms per milliliter. It's hard to say how much cannabinoid that is because there's no regulation. Even on the legal cannabis products, we don't really know how much active THC is in the products that we're ingesting. But according to this policy, if your cannabis is in your system at over 50 nanograms per milliliter, that would be considered a positive test. These different drugs stay in your system for different lengths of time. Some of these drugs are water soluble and are in and out of your system relatively quickly. And cannabis, for one, is fat soluble, so it will stay in your system detected for a longer period of time. Again, as long as your substance is under the cutoff level, it will not show as a positive test. But if it's over the cutoff level, it's considered a positive test. So what happens when you have a positive test? We want to be sure that it's a verified positive, that there's not a medical reason for you to be taking this drug. So all results are reviewed by a medical review officer, a physician that has specialized training in drugs of abuse. Either you have a verified reason for the positive, or you're going to have a true positive. If there are verifiable medical reasons for the positive test, then the results will report it as a negative test. For example, you have a personal prescription for something that you take for medical reasons that resulted in a positive test, and you were taking it appropriately. There are consequences to a positive test. Employees are removed from any safety-sensitive job while an investigation takes place, and it may result in your termination, or you could be offered a second chance. If a second chance is given, the employee is subject to random testing at their own expense. Now we will turn our attention to some education about alcohol and its abuse. It does not matter how alcohol gets into your system. Enjoying a 6-ounce glass of wine, a cocktail, or beer. Any of those 6 ounces of wine, a shot of liquor, or a 12-ounce beer all equals about 15 grams of alcohol. And it takes generally 1 to 2 hours to metabolize one of these alcoholic drinks. Mixed drinks averages are based on typical drink recipes using 80 proof liquors, but as we know, some liquors might be 100 proof or higher. So it does depend on what kind of liquor you're ingesting. Moderate drinking for males is about no more than 4 drinks in a 24-hour period, and for females would be 2 drinks in a 24-hour period. We all know that alcohol can affect you depending on how fast you drink, how much you drink, what and when you have eaten, your body weight, the type of alcohol you drink, the type of mixer, temperature of the alcohol, and even the atmosphere. Most of the positive drug tests I've seen in my career happen to, or positive alcohol tests happen when an employee has had too much to drink the night before and comes into work not realizing that they still have alcohol in their system. So in this example, at 2 o'clock, the person goes to sleep with 0.12 alcohol in their system. Even though they're sleeping, it only metabolizes at about 1 drink per hour. So when they wake up at 7 o'clock to go for work, they still have alcohol in their system. And even at a morning meeting at 9 o'clock, you can still have alcohol in your system. Alcohol abuse causes problems to the whole entire body: anemia, cancer, gout, seizures, pancreatitis, high blood pressure, and cardiovascular disease. There's some questions you can ask if you're concerned about you or a family member who are dependent on alcohol, such as you cannot quit drinking or control how much you drink. You need to drink more to get the same effect. You may even have withdrawal symptoms when you stop drinking, such as feeling sick to your stomach, sweating, shaky, or anxious. You spend a lot of time drinking and recovering from drinking, or you've given up other activities so you can drink. You may even have tried to quit drinking or cut back the amount you drink, but you haven't been able to. If you continue to drink, even though it harms your relationships and causes personal problems, you are likely dependent on alcohol. Now we will switch our attention to the drugs of abuse. The healthy brain on the left shows lots of oxygenated blood going into the brain, which is shown by the yellow scan. Shows up as yellow on the scan. On the right hand, the diseased brain, after using and abusing cocaine, you see that there's not enough oxygen getting into the brain cells. Cocaine's fast facts is that about 1.7 or 4.8 million people in the U.S. have reported using cocaine in the past 12 months. Among Americans age 12 or older, about 1.4 million people had a cocaine use disorder in the past 12 months. And that would be 1 out of every 3 user has a cocaine use disorder. And we still have close to 25,000 Americans that are dying from overdose related to cocaine. Cocaine gives you a feeling of energetic rush, no need for sleep, talkative, agitated, and then it's followed by a crash. There's different forms of cocaine, including a smokable form called crack. Sometimes on the street it's known as rock or coke or snow. It's a central nervous system stimulant. It's often combined with other drugs, and it's highly psychologically addictive, but it's not physically addictive, meaning when you stop using cocaine, you don't physically get sick. But psychologically, it's a very strong addictive properties. Now we'll talk about cannabis, another one of the categories. Cannabis is also marijuana. The active ingredient is THC. It causes increased heart rate, bloodshot eyes, dry mouth, and hunger. It can stay detected in your system up to 30 days. Again, it depends on how much you're consuming and how frequently. Because it's fat soluble, it can build up in your system over time. Again, we don't think of cannabis as being particularly physically addictive, but psychologically, people can get addicted and feel like they need to use it every day. Some of the fast facts about marijuana is it's the most common used federal illegal drug in the United States. About 18% of Americans have used it at least once in the past year. And again, 3 in 10 people who use marijuana have a marijuana use disorder where they feel like they need to use it to feel normal. Marijuana use directly affects the brain, specifically the part of the brain responsible for memory, learning, attention, decision-making, coordination, emotion, and reaction time. This is especially susceptible to children and teens that have adverse effects because of their developing brains. Long-term or frequent marijuana use has also been linked to an increased risk of psychosis. And there are many instances of a risk for pregnancy complications when cannabis is being used. We know that it's become more legal for recreational use across the country, but it's still not appropriate in the workplace. Most of the states have laws that prohibit its being under the influence in the workplace. And even OSHA says that post-incident drug testing can still be done even if you have legalized marijuana in your state. It's not appropriate in the workplace. Quest Diagnostics, who does most of the drug testing in the U.S., has reported testing positive for marijuana has now hit a 25-year high. Post-accident positive rates have also climbed. Cannabis also impacts on driving skills, even if you're just an occasional user. Cannabis affects your visual field, reaction time, decision-making, concentration, and road tracking. It's similar to having a low dose of alcohol in terms of impairment. If you choose to have alcohol and cannabis, you will most likely have an additive of impairment when driving. The research shows that occasional marijuana users will feel like they're actually driving better when they are using, but the research shows that they actually drive worse. The next group of drugs is amphetamines. This can be referred to as speed or meth. It's also a central nervous system stimulant. There's pills, can be a powder form or even injected. It's a longer lasting rush than cocaine, but it's followed by exhaustion. Ecstasy, which is MDMA, is a synthetic amphetamine and is in this category, can be found in your system if you take it. Amphetamines can lead to chronic sleep problems, nervousness, nutritional deficiencies, high blood pressure, paranoia or psychosis, and even addiction. The next category is opioids. Fentanyl has been found in the Ohio drug supply. Most recent research shows that it's about 27% of all opioids that are out on the street have some level of fentanyl in it. Fentanyl is highly lethal. It's equivalent to about 10 times stronger than heroin. You can see the little tiny bit of heroin that's a lethal dose on the left vial, and the equal lethal amount is just a few granules on the right. Some typical opioids include some prescription medications like codeine and morphine, but also street drugs like heroin. They can be prescribed. They produce a feeling of euphoria followed by drowsiness, and tolerance develops very quickly, what can lead to addiction. The last category are just what we call designer drugs and analogs, which include phencyclidine, which is PCP, or other kinds of drugs like LSD, mushrooms, and synthetic heroines. All those analogs also lead to psychosis, impaired speech, irreversible brain damage, and even death. There's psychological and physical effects by taking designer drugs and analogs, and obviously should be avoided for your own health care. As we wrap up, we're going to talk a little bit about the stages of addiction. Phase 1 of stages of use and addiction is when a person is learning the effects of a substance. Every person who drinks more than once, having some kind of alcohol, will go through this stage. It's when we learn how to handle the alcohol. Stage 2 is seeking a mood change. We use the drug or alcohol in socially acceptable ways. There may be an occasional hangover, but no other negative consequences or problems. The majority of us who drink alcohol stay in this phase for the rest of our lives. Just phase 2, seeking a mood change. If you continue drinking more than you should, you'll move into phase 3, which is really an abuse stage. The use of the drug or alcohol becomes more frequent or inappropriate. It's used to medicate your feelings. There'll even be some negative consequences. A person can stop at this phase and never become physically addicted, and really should if they start to recognize the signs of problems. Stage 4 is when dependency really begins. The person's lives become more focused on the chemical. They may not use it daily, but when they do, the following symptoms might occur. Things like loss of control or tolerance, continually using to escape, personality changes, denials, blackouts, or even legal, family, or emotional problems. The final stage is really stage 5, using to feel normal. This is the last stage of the disease, when a person needs to use either alcohol or their drug of choice just to stay alive, to feel normal. They're no longer enjoying its use. They feel like they have no control over its use. Withdrawal is a reaction if the substance is halted, and death is a real possibility. Remember that addictions are treatable. The problem just needs to be recognized and admitted. You don't have to want to quit, but you do need to complete a treatment program, and you will need support for the rest of your life. Need to remain sober. You cannot use any mood-altering substances if you are addicted. Many effective and productive employees are people in recovery from addictions. So just recognize that there is help and stay strong, because recovery is possible, even for one of your family members. The campus of Anna Maria of Aurora has identified where in the local community to get help, and it's listed here. Let's review the course objectives. We identified your policy components. We listed the drugs and the cutoff levels. There's 5 drugs for which you can be tested: cocaine, cannabinoids, opioids, PCP, and amphetamine. Drug testing occurs according to your policy. Please reference your policy to identify when drug testing can occur at your workplace. We discussed a little bit about alcohol and drug awareness and how it can affect your body. And we let you know where to get help for either you or a family member if needed. Thank you for your attention. I've appreciated your time. Make it a safe day.